Awesome. All right. So we are all set up for this evening. Good evening. Thanks for tuning in to another episode of JeffCo Health Matters this evening. That's when we talk about the health matters that matter to Jefferson County Health. See what I did there? I was very excited about it. My name is Brianne. I'm the Public Communications Officer for the Jefferson County Health Department. Tonight, we're actually going to be talking about a very important topic. It's kind of prevalent right now, especially with the school year coming up right around the corner. We're going to talk childhood immunizations. So this evening, I am joined by two of our public health nurses, Sarah, who's sitting with me, and then Andrea, who's joining us on Zoom. So ladies, thank you for joining me. Do you guys want to introduce yourselves and tell us a little bit about what you do here at the health department?
Sure, thanks for having us. I'm Sarah Warnicky. I am a registered nurse. I've been a nurse for 23 years now. 14 of those years, I have been a public health nurse at Jefferson County Health Department. And public health is definitely my passion, especially immunizations and working with the kiddos.
Hi, my name is Andrea. I'm an LPN. I'm a vaccine coordinator with the Jefferson County Health Department. I definitely agree with Sarah. I have a lot of passion for vaccinations for children and adults, and hope more people come out and get some.
And that's why you ladies are the ones that are joining us this evening. So before we kind of jump right into like the main topics and some questions and stuff like that, let's first just chat in general. Childhood immunizations, why are they important? Like, we are surrounded by this information all day. You ladies more so than me because you're nurses. But why are vaccines important? What do we want people in the community, specifically parents, to know?
Vaccines are important because they decrease the burden of disease. And in some cases, they can eliminate disease. If we think about the polio vaccine and how polio was nearly eradicated across the globe. I think it's also important work because when we receive a vaccine, that also helps protect our loved ones, helps protect our community and those around us. And they're more important now more than ever because we do have a certain population of healthcare providers and parents who have never seen some of these vaccine preventable diseases. And that goes directly back to how well these vaccines work. So we have a cohort of physicians who've never seen chickenpox,
right,
who have never seen a case of tetanus, thank goodness. Yeah, so that's why they're important.
Right. Vaccines are super important. So let's talk about the required and recommended vaccines for children, and like, what's the difference? I mean, obviously we know the difference between the word required and recommended, but what's the difference between that, and where can people find more of that information?
So required are vaccines that are provided by the CDC guidelines per state. In our state, there's several that are required for school age child and middle and high school, also for colleges. The recommended are more so for different areas that you may be in, that you need this vaccine because it's going to have more of an abundance of this type of disease. So it prevents them from getting that and spreading it to others.
Right. So talk to me a little bit about catching up on vaccines, because last school year was kind of crazy. And there were some grace periods that were kind of in place for things, in particular to those required vaccines for schools. So talk to me about like catching up on those, and is there a grace period this year? Do we know for vaccines? What does that look like? Nope. We're both
There's no grace period right now. Okay. With the schools or anything that we've been given. Now that may change, we don't know. But catch up is all due to their age of what they need and what they're required at that time. But once again, all on CDC guidelines on what is required at that age.
Right. And what's great about the catch-up schedule is That allows us to get the child the vaccines that they need to be in compliance with state laws and school requirements, gets them in the classroom. Even though they're behind, we will provide an in-progress card, and that allows them to attend school even though they're not
fully
completely
done.
caught up yet.
Right. That's a good point, because I didn't think about that,
Yeah.
but that's a good point for sure. And we can do catch up vaccines, and there's actually a really great resource. I'll put it in the comments below, and it'll be on the website on the JeffCo Health Matters page. We post all the resources for each episode there, but they have a really great graphic. It's color coded. It's a nice chart that shows these are the recommended, these are the required, here's the ages, here's the grade levels. It's super easy to read and to identify, and I think that is super helpful. So we'll definitely link that in the comments for sure, especially with back to school season coming up and people being like, I don't know what vaccines to get my kids. What do they need? I don't even know.
So Brianne mentioned all of the colors and how nicely the chart is laid out, and there are several pages of notes that accompany that. So please feel free to reach out to us at the health department if there are ever any questions or you need clarification and understanding that chart.
For sure. Yeah, I'm glad you mentioned that. So kind of as we alluded just a little bit here, we do provide immunizations. We do adult immunizations too, but we're focusing on childhood immunizations today. So we have the ability to provide vaccinations in our clinics and out in the community, but we also have the ability to do that at no cost for those who are eligible because of the Vaccine for Children's program. Could one of you guys talk to me a little bit about this and give some more information? Because I think maybe there's some parents out there that don't know this exists.
So the vaccine program is for birth until the age of 19. So if they have Medicaid, they're underinsured or uninsured, American Indians, but we definitely work with them on any type of vaccine that they require for their children.
And how do we, so is this like, this is a state program, right? This is a state funded program. It's called, I know it as VFC, but it's Vaccines for Children, right?
Correct.
That is correct.
Yeah. And so if the kiddo is on Medicaid, they just have to show like a Medicaid card. They don't have to show a Medicaid card?
They will provide their Medicaid card at the front office.
Perfect.
As part of the check-in process.
Okay.
For those who end up being uninsured, there really isn't any type of a verification process for that.
They just have to sign the thing that says, hey,
yeah, they don't have to bring in financials.
Right. We could really use this program to help us get our kids vaccinated. Perfect. Yeah. So another one of the cool things that we do, and it's actually kind of one of my favorite projects to work on throughout the year with JCHD, is our vaccine clinics. So obviously people know these now as COVID vaccine clinics because that's kind of the new one that it's like the new fad, you know, to do these. But we also do other clinics, which I always find to be a lot of fun to participate in. We do particularly with our schools in regards to our childhood immunization. So we tend to partner with schools at like springtime for like school registration for kindergarten and things like that to get those immunizations caught up or ready for the next school year. But we also do the school flu clinics, which I love being a part of, where we go into the schools at any district that wants us to come and hang out. We pre-register the kiddos, we get them all set up, and we can provide flu shot for those kiddos on site. Yeah, it's awesome. I really like that program. So I kind of just talked a lot about our community stuff, but tell me about like how we do immunizations here. What building do we do? How do people get signed up? What do we recommend?
Andrea, are you okay if I take this one?
Yes.
Okay. So like Brianne said, we can offer immunizations in a lot of different collaborations. So you can come to our offices and be vaccinated. We do encourage appointments for that. That just helps us be respectful of your time and be more prepared for you when you come in for a vaccine. Walk-ins are welcome, especially during high volume times of year, like we're getting ready to go into back to school, and also flu season is on the horizon.
Right.
our school districts and our school nurses have been invaluable partners for getting kiddos in our community vaccinated. We absolutely love going into the schools because that is perfect public health at its best. We are breaking down barriers. We are making services convenient. We are getting the important work completed in a safe, effective, and fun atmosphere. It's fantastic.
This last year it was the three of us. We were the flu van that was coming by, so it was kind of fun. So we get a lot of calls and a lot of messages like through socials or emails and whatnot. Folks want to know how to get a copy of the vaccine record. Obviously, like for school starting up, or if their kiddos going into a sport or any kind of other extracurricular activity. And they just need like, hey, I need a copy of my kid's vaccine record. How do they do that? What can they do?
Well, they can call us, and as long as their doctor has access to the Show Me Vax, then all their records should be on there. Sometimes that's not the case, so they may need to follow up with their physician's office and get a copy. But otherwise, we can give them a copy at our office at no problem.
Yeah, and that's at no cost too. Like if you just want to come in and say, hey, my name's such and such, I need a vaccination record for my kiddo, here's their information. And like you said, if it's in Show Me Vax, we can pull it up and get you that copy and you're good to go. And Show Me Vax is just the state system where all of that information is housed. So for us non-nurse people that don't know what that one is. So one of the things that I kind of wanted to talk about just a little bit that we kind of chatted about in preparation for tonight's segment was some of the myths and miscommunications and misconceptions that are out there about vaccines. So one that we get a lot, or that seems to be kind of common, because actually the CDC and immunize.org have a really great presentation and some follow-up resources on this particular topic, is just, and I'm going to read it verbatim right here, won't giving my child so many vaccines overwhelm his or her immune system? And we get that a lot. I know that I've even had family members that have asked me that. They're like, they're so little, like, what do we do? But there's actually really great research that shows why that's not necessarily a concern.
Correct. So I get it. I'm a parent and my wee little one was vaccinated. And when it is time for 4 vaccines all at the same time on this wee little one, it can be stressful.
Right.
Yeah. Being a healthcare provider who has seen pertussis, who has seen chickenpox, I can also tell you, wow, how much easier to see those 4 vaccines all at once, other than the live virus take hold in your kiddo. There is plenty of evidence that proves whether we give 1 vaccine or 4 vaccines at a time, the immune system is boosted in the same manner. It's not going to increase side effects. They are safe to be administered together. They are just as effective when they're administered all together. If we take it a step further, I think another great thing about trying to get multiple vaccines in one visit is it keeps your kiddo on track. So you're not doing a delayed schedule where they would leave out of the provider's office susceptible to one of the vaccines that they are currently eligible for. And it also cuts down on the number of visits. I would much rather go to 2 visits where I get a couple of vaccines versus splitting that up into 3 or 4 visits. It really does cut down on the stress.
So as a 90s kid, who my mom took me into the doctor's office to get, our vaccines. And like every time we had to get a vaccine, we always got some kind of treat, right? Like ice cream or a smoothie or something. So like as a parent, I can kind of see how you're like, let's just keep these all on track because otherwise I have to get her an ice cream every single time we come. Like that takes a hit on the budget, you know? So I see what my mom was up to.
That's another very valid point.
Right, exactly. Someone so yeah, that was actually kind of one of the other questions which you kind of alluded to. Some people say is like, can't we just delay some of these vaccines? Can we, instead of giving them all at once? But
I'm sorry.
You're good. I mean, that's it. That does leave them more susceptible to those. And I agree. Then just extra appointments and more ice cream visits. So like, cut that down. So there was there's another pretty hot topic that goes out there when you think of childhood immunizations. At one point, there was some talk about whether or not MMR vaccine would cause autism. And so there's a lot of research that has been done about this. There's a lot of studies out there. And again, we'll link a lot of this information. I'll put it in the comments and I'll put it down on the website with all of the articles and the research and different things and whatnot. But basically, this is not accurate. There are studies that are showing that it is safe, effective, and a good idea to get these vaccines for your kids, right?
Correct. If this is one of your concerns, I would encourage you to go to the resources that Brianne is going to provide to do a little more reading up on this. This was disproven by our friends at the CDC, and they actually published it in the British Medical Journal and used words to highlight how inaccurate this was. Words like irresponsible, an irresponsible study, dishonest information. So again, I would encourage you to go to the resources that Brianne is going to provide if you have questions or concerns, and you're always welcome to reach out to us and have a conversation.
Yeah, for sure. That was definitely one that someone had in the comments was, make sure we encourage folks to read up on it. Absolutely. Like there's going to be a lot of information that I'm going to put in there. There's all this stuff at the CDC website. And then like Sarah said, you're always welcome to give us a call or message us if you have certain questions or, want more clarification on something. Our nursing staff is really great and they're pretty chill. So they're open to answering these questions. I just signed you guys up for stuff, but notice I don't have the degree to answer those questions. So that'll be on you.
I think another point, I'm sorry, and just throw this in there. Something to keep in mind about the timing of the MMR vaccine and the timing of autism diagnosis happens right around the same time.
Right.
So 15 months old, I mean, they are movers and shakers. They're starting to talk. And that's when we start to notice some of these maybe developmental delays or speech delays, those types of things. And that's about the same time that kiddos are getting their first MMR dose. So I think that is why, there was a valid concern about that. But again, just go to those resources that Brianne provides.
For sure. I'm going to check the questions really quick and see what we have. Then let's see. Sorry, I'm looking at my phone for questions. I'm not tweeting right now, I promise. So really quickly, let's double check. I know one of the questions we had was in regards to posting links and information where they can find additional resources. So again, I'll provide that. And then I know we had another question about, I just saw it on here a little earlier. Sorry, I don't scroll as fast on here. These people care about us. Thanks for all your work. Thank you.
Aww.
We appreciate that.
Aww, thank you.
Let's see. There it is. Everything will be great. Oh, okay. So that was just a so-and-so was watching. So never mind. That was not a question on there. So, I mean, one of the other things that I did want to chat about really quick, just because it is it's a topic that's come up, it's kind of in relation to childhood immunizations in general, is what is the most important thing that we want parents to know and understand about immunizations, like when you're in the office, you're having that like just that one elevator speech, because I think that's so important to just like reiterate and kind of come back to as we're waiting to see if any other questions come up or like channeling that. But what is, as a nurse, what is the one thing that you always tell parents? Like, here's what I think.
For me, I want to meet families where they are.
Right.
And I want to help get their concerns and their questions addressed. And I want to help them do the best that they can to protect their child and their families.
Yeah, that's good. I like that. Okay. That was good. Good job.
And for me, I just think a family knowing that they can prevent these illnesses and these diseases is so important in the healthiness of their child and them surrounding other people in their family to prevent anybody else from becoming ill or sick.
Right. And I think that we kind of alluded to that at the beginning too, but vaccines also affect others in the household as well. So just things to keep in mind. I'm not seeing any vaccine related questions that are coming up, and we're kind of getting close to our time. So we can kind of end this conversation for this evening. But if you guys do have additional questions about childhood immunizations or more specifics, you can reach out to us. Obviously, you can drop your comments or your questions in the comments. You could always message us. Our email is communications@jeffcohealth.org, or give us a call in our office. Like I said, if you have a specific question, our nursing staff is always happy to help answer those questions. So actually, the next episode that we're going to be doing is August 11th. For JeffCo Health Matters, and we're going to be talking to some of our community health team again, and we're actually going to be talking about the Jefferson County Health Network Behavioral Health Assessment and kind of like how that's going to be rolling out and their new projects. So I'm very excited to talk with them about this. This has been a labor of love for our community health program, for like 2 years now. They've been working on this, so I know they're eager to chat. So that one's going to be a good one. Make sure you can tune in to join us for that one. If you have any suggestions for future topics or things that you want to learn more about in regards to Jefferson County Health Department or just public health in general, give us a shout out and let us know. If not, you can always reach us at communications@jeffcohealth.org or our number 636-797-3737. Thank you so much for joining us this evening, and we'll see you soon.